It is your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to preparing lasting solutions. I am your regular anchor, Shumowa Danis. Our focus this week is on community health practitioners and their relevance in the nation's healthcare system. Please don't go away. We'll be right back after the news segment.
No fewer than 200 Lagos residents from Ekpe and Badagry divisions of Lagos have benefited from a free eye surgical expedition program sponsored by the Lagos State Government as part of efforts to reduce blinding eye conditions among residents. The surgical exercise, which was carried out between Tuesday 6th and Thursday 8th December 2022, in partnership with the leading eye care foundation, the Indo Eye Care Foundation, was preceded by a screening exercise where over 1,000 people were screened for varying blinding conditions. Speaking during his visit to the screening site, the Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye, explained that the Lagos State Government regularly embarked eye care outreaches to communities as part of efforts to improve access to good eye care services and prevent avoidable blindness.
Well, the eye is the window to the soul, isn't it? And it's very important that people can see, especially when you have a problem that's so easy to correct. One, a lot of eye problems are preventable, and then a lot of them are also treatable. And so it's sad when people are handicapped or incapacitated with a problem that can be solved. Sometimes they are also aware it can be solved, but they just don't have the money to do it. And so people are living in blindness, so to speak, when a simple corrective surgery can be done to deal with the problem. So that's what we're trying to do, to put light back into people's lives by restoring their sight. We're doing all the local governments, reaching them as by divisions. So we're doing it in phases. Lagos is divided into 5 divisions, the Ibile divisions. So we're doing them 2 at a time until we reach the whole of the state.
Ogboye further explained that the free surgical expedition program is targeted at addressing cataract and pterygium excision, which are among the leading causes of blindness, vision loss, and eye impairment worldwide. He added that the program is in fulfillment of Governor Babajide Sanwo-Olu's promise to increase access to qualitative eye health care services in Lagos community.
It's going to be an annual thing. We had started it before, but now we're partnering with Indo Eye Clinic because they have really, the Indo Eye Foundation, they have a really wonderful theater that's really, really high-tech and state-of-the-art, and they're donating they're allowing us to use it, and they're also giving us some of their staff to assist us in this.
The Ministry of Health, through the Blindness Prevention Program, is responsible for this program because the Blindness Prevention Program is saddled with the responsibility of reducing blindness among the citizens of Lagos State. We started in the month of October, and we informed the people that we will still move around the Ibile zone. So in October, we went to Ikorodu division and Lagos division. Now we are covering Ikeja division, Ekpe division, and Badagry division. Child can have congenital cataract. You can have cataract from trauma. You can have cataract from the use of steroid. You can have cataract from ultraviolet rays and radiation. But all these cataracts, the solution and the treatment is surgery.
Don't have money, and when somebody told me that they are doing something free here, that's why I came, and they did it for me free. They did not collect money from me, and they did it well. My eyes can see well. Thank you very much. Thank you, Lagos State Government.
I'm very happy, particularly because this problem I've been long with it. But I'm happy for the people that organize, for us to come and, benefit from what the state government has done. And we are very grateful.
He urged citizens to get their eyes checked at least once every year, especially if 40 and above.
There was one that happened yesterday at Ajao, so that the man killed the wife and all that because of water, stabbed her on the neck.
Another one killed his wife for refusing him sex. Another one, probably, women are being blinded, killed, maimed, prevented from achieving their potential.
It's very predominant, in the society now, especially in Lagos State. We've been having a lot of it. But kudos to Lagos State government for the enactment of the VAP Act.
The speakers here are human rights lawyers who handle cases of sexual violence. From their records, they are worried that hardly a day or week passes without a case reported, a situation they say calls for more awareness and quick punishment for offenders. Lagos State in the last 1 year has recorded over 1,616 cases of sexual and gender-based violence and over 1,150 involving children.
Action should be taken, not only in legislative policies, but also in educating people to have them change their mindset. Policies and law can do a lot, punish deviant behaviors, but you can't put 80% of the culprits in prison because we don't have enough prisons for everybody.
We all have to come together as one so that we curb all these menace. There's a law guiding all of us. We should abide to the law.
And it's high time that everybody engage the space, not just women, even men, because we need everybody to support and create awareness.
Going down to the grassroots to actually talk about these issues, because most women don't really know that they're being faced by this violence, but emotional, because violence is not just the physical one, it's emotional, it's psychological, and most women don't really know about these issues. So we need to go down to our grassroots to talk about these things, have clubs in school where we can talk about, gender-based violence.
With several campaigns that characterized the 16 days of activism in the last few days, many had expected to see a drastic reduction in cases. But the recent report from Ajao area of Lagos State leaves many in doubt as to whether the country, particularly Lagos, is winning the battle against sexual and domestic violence.
On a yearly basis, members of the Nigerian Institute of Medical Research, NIMR, gather together for a retreat. The aim is to unwind and assess set goals for the year, the successes and gaps recorded for improvement in the coming year. For the 2022 edition, the Sheraton Hotel Ikeja provided the appropriate venue with a focus on the theme, diversity and inclusion in the modern workplace.
We realize that in the society, you have people of diverse origin, character, culture, and religion, and beliefs. And these people necessarily have to work together to move their establishment forward. Whereas some of these diverse quality of these individuals may have effect on how the individual allows himself to join and work with others to achieve a set out objective. More importantly, if someone is leading others, such individual needs to recognize the different backgrounds that people are coming, and that may have effect on their thoughts, their reasons, and what they do. So it's not a straight-jacketed thing for such leaders to feel that everybody should understand what he or she is saying. You therefore needed to listen to everyone and then be able to put into consideration such diversity to be able to get them to understand that you set out.
Inclusion and diversity, they go hand in hand. It's not enough to just recognize the diversity, but also to ensure that there is inclusion and representation of all these various characteristics within the workplace. And this leads to productivity, increased productivity, increased teamwork, increased retention, and then at the end of the day, you'd want people to feel comfortable in the environment where they work. With advances in technology, advances in changes in the world. The world is no longer, isolated, but a global village. There is a need for us to recognize these various sectors, these various compact diversity in the institution and organizations for things to improve.
The Director General of the institution, Professor Babatunde Salako, and guest speaker Sylvia Adebanjo took time to speak on the health sector performance in the year, the success in malaria control, and lots more.
We think that we have made our marks in the area of clinical research and, of course, experimental research, and coming out with some innovations that can improve disease detection in country, and then also capable of improving our health system. We've done a lot more with training. We're training a lot of people from several universities across the country who come for 3-6 months. Sometimes people come to do bench work in 9 months. So we feel fulfilled that in 2022 we really have achieved significant parts of the strategic plan that we have drawn out for ourselves, and of course with the Ministry of Health. We discovered a new malaria vector, and we confirmed that, we reported that to the WHO, and we passed the same report and brief to the Federal Ministry of Health. Now the implications of that is that we can therefore begin to look at malaria control with different perspectives in view of the new vector, and then be able to change whatever strategies that we have so that we can improve malaria control in Nigeria.
The health sector, I would say, has really improved in the sense that, there's recognition of, I would start with diversity, not just the fact that, you have, the old hands that have been retained over the years, but it has also opened the doors to new and younger healthcare providers, researchers. There's also the recognition for research. And without research, there can be innovation, there can be creativity. So I think we've come a long way. There's a need for, collaboration. Collaboration came to bear in a very productive way, in the way all the sectors came together, across Nigeria to tackle the COVID pandemic. Given that as an example, I think the health sector is well poised, for the future, trying to embrace the need for creativity, the need for diversity, the need for inclusion, so that everybody comes together, puts their hands on deck to move the health sector and all the sectors in Nigeria to the next level.
Individuals who have given their best to the organization and contributed to the successful combat of COVID-19 pandemic were recognized. Over 16 years experience in clinical and administrative role in the healthcare space, Dr. Olayemi Daudu and our world-class organization, Clean Lancet Laboratories, on a yearly basis contributes to the Nigerian health sector growth through offering of basic services and provision of valuable health information to the public. As part of activities to commemorate its 10th year anniversary, this forum was organized with a focus on healthcare diversification in a developing economy on the 8th of December 2022 in Lagos.
And when we talk about diversification, we're talking about increasing the products or services that you have. The healthcare space, we know, is segmented and made up of different areas. So you have laboratories, hospitals, pharmaceuticals, and co. And the general idea is to begin to talk about how do we synergize and collaborate together to scale and to be able to, give more in terms of the healthcare space by working together to create a stronger healthcare space together instead of in the segmented way things have been done, and this will help to also scale the services that are being delivered within the space. And it's also important to look at something that's common to everyone in the healthcare space, which is one of our sub-themes, which is healthcare financing. So whether you're setting up or whether you're coming to get service within a healthcare facility, we all need funding.
And on the side of collaborations and partnership, it's a trend that we believe is the new direction or the new way for healthcare providers or practitioners to go, whether partnership with government and organizations. So basically, the areas that we're addressing is that of assessing funds. And this event as well, we have some of the regulators talking about the government side of thing. We'll be talking, when you talk about healthcare financing, what comes to mind is just how you get funds to buy the equipment, to put on the infrastructure and all that. There's little or no attention or concentration on the demand side, how the patient pays, what kind of payment model and all of that. So yeah, we appreciate the health maintenance organizations coming up with the different plans and all of that. Even the government is doing its bit in this space. So this forum actually is to engage stakeholders present and discuss this topic widely, especially in terms of assessing funds. Even when you can assess these funds, there's a key problem, which is the cost of capital. If the cost of capital or cost of finance is quite high, it tends to be factored into your pricing. That it leaves the burden on the patient or the end user. And on the side of collaborations and partnership, it's a trend that we believe is the new direction or the new way for healthcare providers or practitioners to go.
It is a business and somebody has to pay for it. And anything that involves payment means finite resources, right? So I would rather say universal healthcare coverage is not a destination, but it is a journey. It is a journey that we take step by step to be able to provide some form of coverage for some ailment to ensure that people do not go through financial hardship. And this is what we try to do through the concept of health financing.
Speakers also deliberated on measures to curb quackery in the laboratory space.
Policies and regulations are by government. It can't be done by the private sector. So certainly the government has a big role to play in terms of the regulations that are being put in place, the policies, and not just putting them in place but enforcing them. And on the side of the private sector, because for example Cleaner Lancet Laboratories is internationally accredited by SANAS, and what it is that there is a set of processes and procedures that go on in the organization that have been audited and have been stamped that they are at international best practices. I think as a government as well, also working with private sector, we can actually set up minimum standards for these organizations and have for people that go around to ensure that there is compliance in that sector. Those are the ways I would suggest.
And when we talk about quality result, we're talking about a result that is accurate, a result that is reliable, and a result that is timely. Now, for you to be able to achieve this, there are a lot of factors that must be put in place to ensure that this is done. So, collaboration is key because we have from the processes to technologies to infrastructure to equipment. So, there are various key players within the sector and outside the sector that has to bring resources together, including what the laboratory does to ensure that the goal to provide a quality result is achievable. Of quackery is it's a policy thing, and definitely as the government who is responsible, the regulatory body who is responsible are doing a lot, but there's still much more to be done, and the media can also play a good role by ensuring that people patronize only accredited laboratories and only laboratories that are best fit for what they want to do.
Hereby pledge to uphold the code of conduct, statutes, and bylaws of the Nigerian Academy of Pharmacy. I also pledge to contribute to the advancement of knowledge and the promotion excellence in pharmacy to the best of my ability. Congratulations.
That was the investiture and oath-taking of new members into the Nigeria Academy of Pharmacy on Friday, 9th December 2022. The fellows were qualified for selection, having been able to improve themselves in their different specialties as pharmacists.
Out of 63, 20 were elected to be in this prestigious fellowship of the Nigeria Academy of Pharmacy. And this is AGM stroke investiture program. And honestly, this is the time we sit down, we reflect on what happened throughout the year and advocate for so many policies and write position papers to the government to see how do we improve not only pharmacy profession but the healthcare entirely of the country.
It's an encouragement. You know, when you have done well and you're recognized, it's for you to do better. It's for you to work harder. So it will eventually translate to better healthcare delivery in their own areas of specialty. Those in academia will have to work extra hard in order to maintain, this, kind of recognition and fellowship that they have been given.
Baba asked me to tell you that he will remain for the rest of his life a valued member and a worthy member of this academy. And in that regard, he will support you financially, morally, and even professionally as a lawyer. He asked me to extend his invitation to the president and members of the council of this institute to visit him at Adokiti at Abuja, where you can discuss how it can be useful and what role you expect him to play. So once again, sir, I express my deep appreciation. For me personally, it's a great honor to be here.
Issues of collaboration with the petrochemical industries and embrace of artificial intelligence were brought to the fore at the forum to promote local medicine production.
One of the things I've been advocating as president recently is that medicines should not, the tariff should not be so high. We're asking that NAFDAC should not be a revenue generating entity. In that way, the levies placed on medicines will reduce and it becomes affordable to the average Nigerian. I think all in all, the academy is doing quite a lot of work and we are pushing ahead to make sure that medicines become really affordable and available to Nigerians. You all know what happened during the pandemic. If such a thing happens again, we are not ready. It could be disastrous.
At the level of education in the universities, there must be introduced subjects of technology, especially AI, machine learning, and data collection. This is what is making the other countries of the world progress. Why should you, for example, have a country like Nigeria that is still importing raw materials like APIs, when right here in Nigeria, under very feet and around us are flora and fauna that can be used to produce these APIs. We have said that artificial intelligence can be used to make this faster, make this wider, and make partnerships quicker in the production and in the research into drugs.
We have to look at the petrochemical industry. If really we want to promote local production in Nigeria, we must beg Dangote Group. After this first phase of refinery, we have to think of getting the petrochemical angle where we can get raw materials. Without raw materials, definitely there is problem. Then the active pharmaceutical ingredients, even if we don't have the petrochemical, it should attract zero import duty so that our local producers can be able to produce to cater for the 70%, because we are producing only 30% now, and we are supposed to produce based on national drug policy. We should produce 70%, maybe augment with 30% importation, but the reverse is the case.
Nigeria has the best human resources, whether in medicine, in pharmacy, in engineering, in IT, everywhere in the world. So we need to start bringing up the country and make sure that the health sector is the best, for Nigeria.
Established 10 years ago, the Nigeria Academy of Pharmacy has recorded steady growth of members.
We are an integral part of the Nigerian community. We must take interest in what's going on.
Potassium bromate is a banned flour improver globally, as it is a known cancer-causing agent. It could also cause kidney failure, among other ailments. Potassium bromate, popularly known as tablet in the black economy, is always attractive to merchants of death who want to make outrageous profit at the expense of citizens' well-being. This is because, apart from improving the texture of a loaf, it also increases its volume and is relatively cheap.
What we are saying is there are other bread improvers that are acceptable to us as NAFDAC, but as far as NAFDAC is concerned, potassium bromate was banned and remains banned. What the enforcement officers uncovered was 115 cartons of potassium bromate tablets with a street value of 28,750,000 naira. To those who are involved in using this product without a thought to the impact it has on health, because bread is a commodity that is readily consumed in almost every home in Nigeria. And so it has far-reaching impacts on our population. So please don't take that warning very lightly. As I speak, it has already started, and we'll be looking very, very closely. And in the event that we find those that are using these banned products in making approved products, they will face the full extent of the law.
Also found in the warehouse are counterfeit EDC bread improver, packed in sachet, and several cartons of margarine with fake NAFDAC registration numbers.
And they arrested the suspect, Mr. Joseph, during the operation.
Baking materials. Yes.
How long have you been in business?
For baking material, I've been in business for 6 years now. It's someone that gave me the market. So I don't know that the team is very dangerous like this.
It was 400 cartons. And it was bought through the group page. Then when the goods comes, different goods, because maybe you took your own and pay the, that's how it happened. Unfortunately, they say somebody has the same NAFDAC number.
In its renewed drive to rid the country of substandard food and drug products, the agency, a few days ago, charged to court a Kano-based businessman who imported fake products into the country.
They are from Indian origin, and I can also tell you, the investigation is going beyond the shores of this country. We already gotten the company from where the thing was manufactured in India. So government to government, we are reaching out to that company. Those things are not registered, so we cannot guarantee the safety and efficacy of those products that they unscrupulously brought into the country. So that's why we arrested the product. So we went beyond that to go after the importer. Our investigation shows that the man is a serial offender. And so we used all the power within that we have to make sure that we pin him down, because he did everything to evade arrest. He ran away till today. Is still at large, but we brought one of the directors who is a pharmacist representing the company. We brought him to court.
They called for public collaboration to help watch out for these injurious products everywhere in the country and report same to any nearest NAFDAC office.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Welcome back. Community health practitioners are those health caregivers who operate at the grassroots level. Those you see at the primary health care centers, PHCs, and clinics. They are closest to the people in remote villages and all that. They are described as the bedrock of healthcare delivery in any nation. But despite their importance, not much attention is given to them. This was the focus of the 2022 Scientific Conference of National Association of Community Health Practitioners of Nigeria at Badagry in Lagos, Nigeria.
If you look at those that are staying in rural areas, they constitute 70% of the population. And the only thing you can do is to ensure that you take this service delivery to their doorsteps. And community health practitioners are at the vanguard in doing that. And it is only by doing that, those 70% that I mentioned, that do not have access to quality healthcare services. And if all of us are determined to ensure that those vulnerable groups are reached, the government, the practitioners, and other major stakeholders will work together to ensure service deliveries are reached to those grassroots areas. Yes, there are a lot of challenges. One, we want the federal government, state government, and local governments, particularly the local government areas where they are the constraint of this level, to ensure that whenever they are constructing health facilities, they should put in their minds where this caliber of health workers will stay. They should ensure there is security for health workers that will provide these services. They should ensure there is remuneration where you will see community health practitioners working. There is every need that you should motivate them. You know, they are staying in hard-to-reach areas. They are staying in where there are even insecurity. So when you have accommodation for them, when you have remunerations that will at least commensurate with the services they are rendering, and then ensure the capacity building is also entrenched. In-service training should also be encouraged. Ability to have access to other academic programs, whether within or internationally, should be encouraged. Just the way other professional bodies are encouraged to stay and render services, community practitioners should also be considered where a lot of practitioners could not go and render services. This is where community practitioners are going. You should understand the magnitude of sacrifice that this group of professionals are making today.
This is capacity building. It's a conference, national conference, and I want to call the professionals to dedicate themselves in updating their knowledge and ensure the knowledge they acquire here in this conference, let them put it into practice and ensure they judicially use their standing order in managing healthcare. When they do that, actually I'm telling you, we go a long way in reducing the rate of death in Nigeria and even the fatality, and equally provide a good coverage in terms of healthcare services, like the issue of COVID-19 and other way. So they should use the standing order in their primary care assignment. At least they can improve the service delivery in all the aspects of healthcare in Nigeria so that we can achieve the Sustainable Development Goal in providing healthcare services and ensuring universal health coverage in Nigeria. Challenges facing the community health practice in Nigeria, there are many. I'm happy the government of Nigeria are doing best to community health practice, but when you consider resources are major problem, financial resources, human resources, and sometimes we have our members lesson and practice within Nigeria, and they are not employed in the government establishment where they are supposed to work. So these are major challenges.
So at least we are calling for all government at all levels, both at the local government level, at the state level. We have abundant community health workers. And in our profession, there's no brain drain. I know most medical doctors and also go overseas, but our community health workers are here within Nigeria. When they are effectively utilized and posted PSC centers and hair cleaning, at least they carry the standard of healthcare in Nigeria, where we can achieve what we want to achieve in reducing the maternal mortality rate in Nigeria and even infant mortality rate. When we say community health workers, that are people that are trained in School of Health Technology for a period of either 2 years, 3 years, or 1 year, and certified with the license to practice as community health workers and posted to primary care to work. When you look at after the Alma-Ata Declaration in 1978, it was launched back in Nigeria. Then the Minister of Health proposal, Oliko Erenson Kuti, launched the primary health care, in which community worker has been posted to primary health care clinics in order to address health challenges of a community in terms of preventive, promotive, and curative aspect of health care in Nigeria. On my assessment, actually, we have done a lot of development. When you consider, let's just give me the recent example. We have infant maternal mortality rate in Nigeria. The indices has been reduced, not as before. And when you look at there are some public health emergency that was addressed, and all community health workers contribute that aspect, like immunization, polio eradication, malaria prevention and control. These are all aspects that community health key in, and they give their contribution, and we succeeded.
Yes, primary health center is the closest to the people, the first contact when you have any form of ailment. This is the institution, so to say, that takes care of the primary ailment. It's because when they functions very well, it takes off a lot of pressure from the secondary institutions like the general hospitals. And there are ailments that you don't take to general hospital. PHCs, you will be able to settle it, not to talk of tertiary institution. So when the primary health sector is functioning very well, it takes a lot of pressure from the secondary and tertiary institutions. Like every other sectors of life, there are challenges. We have funding, we have personnel, and we have accessibility, because some of these health centers are located in remote areas, hard to reach, quoting words from there, hard to reach areas. And the set of health workers that you see in all these places are these these health workers. They are everywhere, all the nooks and crannies. They are the first set of people that you cry to save you health-wise, and they are the one doing the job. I heard a lot of things, and I see the more their importance. And what they are yearning for is to give value to their standard, to their status. Like some of them who are degree holders, there's no point asking them to start from rudiments, while their contemporary begins from level 10 and the likes of that. But they are the ones that will say, we are here. They are the ones that will dot their I and cross their T's, so that the government will recognize them and lift them to their deserved position.
This profession is a profession to be reckoned with, one. It's a profession that needs to be given much attention. It's a profession that saves costs, because the idea that I say prevention is better than cure is a good idea, because if you prevent, you don't cure. And by the way the Nigerian government is going now, I don't think we have much to care for serious illness. So in that wise, we need to prevent illness. And this is the profession that does that the more. That is why we felt it is the best idea for government to buy into policy that will prevent disease and save cures. Health problems start from the grassroots, the local government up to the state and federal level. So we need collaboration. But with this conference now, we are seeing collaboration.
The primary health care is beginning to get the kind of recognition that it deserves, but except some few challenges. But as for me, when you mention primary health care, you can never overemphasize the role of community health practitioner in it. And at the same time, when we mention primary health care development agency, that means you know who we're talking about. We're talking about community health practitioner, and I can stand anywhere to say it. Community health practitioner owns MPHCD. And if you look at the minimum requirement standard for primary health care, you can see the number of community health extension workers that should be in primary health care, the number of community health officers that should be in primary care, and the number of junior community extension workers that should be in primary care. So you cannot take away primary health care from community health, and you can never take community health away from primary health care system. What I think that needed to be done is to increase the capacity of officers that work in primary health care. That means let them employ more community health practitioners into the system and let them do their job, let them do their role, give them that responsibility. I know they can do it, and they've been trained to do it, and they will do it.
If you're just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices on our nutrition segment every week.
The carrot is a root vegetable, usually orange in color, though white, purple, and other varieties of colors do exist. People have been eating carrots for over 5,000 years. The plant, according to researchers, originated in the Middle East and Afghanistan. Carrots was originally cultivated for its leaves and seeds. Carrot is a nutrient-dense root rich in antioxidants, fiber, beta-carotene, other vitamins and minerals. Consumption of carrots is good for vision, promotes hair growth, weight loss, regulates blood pressure, lowers cholesterol levels, and helps eliminate toxins from the liver.
On our clinical segment, we give you tips for healthy living. Please join us on our perception segment on how to improve human lives and the nation's critical infrastructure.
Ease of doing business intervention has delivered several reforms over the last 6 years since 2016. How to register your business, how to get NAFDAC registration, CAC business registration, paying your taxes online, filing your taxes online. So be aware, check things, verify information. It's not business as usual. So knowledge is really power, and a lot of female entrepreneurs work so hard. So these reforms are really for them.
This is where we wrap it up today. Please join us same time next week for another interesting edition of the program. Don't forget to advertise your health products and services on the platform. We give it to you at a subsidized rate. I remain yours truly, Oshomowa Daniels. Please keep staying safe.